So speaking of the population and how they can help individuals with mental illness, how do you feel the overall stigma behind mental illness diseases have changed and over recent times?
I guess anecdotally, I feel like the general public has become more accepting and more aware of mental health issues. Whether or not that's just kind of a growing acceptance versus general awareness versus individuals actually experiencing increased rates of mental health disease, I'm not entirely sure. Just kind of looking at the general media, talking about pop culture, talking about like the general perception of it. Like, I don't have you. Do you guys follow the NBA by any chance, or the NFL?
Yeah, a lot of ESPN articles have come out. I know like Kevin Love has been talking
Yep.
about. He talked about that, and a few other NBA players have come out just kind of explaining, the whole mental illness behind all of, like the media and stuff like that.
Exactly. Like you said before, Kevin Love, DeMar DeRozan, two NBA basketball players have talked about their own struggles with mental health. I believe the quarterback Dak Prescott recently came out, explaining his own issues with mental health. I think there is some residual lack of acceptance, though. Personally, I've been on rotations where I've interacted with a couple of physicians who aren't necessarily accepting of mental health as an issue when I've talked about my interest in it and just kind of seeing where that takes me. Um, for instance, I've interacted with one physician who said that he thinks psychiatry and mental health is a great topic and a great subject. However, he doesn't believe that, he didn't feel that those who actually seek mental health are themselves truly suffering from mental health issues. And then he was also saying that those who aren't seeking help for it are the ones that really need help. So I think there definitely is still a barrier that we as a general public, as a society, need to kind of overcome. And if it's still pervasive in the medical community, then at the same time it's probably somewhat pervasive in the general as well.
So in terms of we talked about a few about the few positives in recent years for mental health, but with the rise in social media, increased stress, as you were talking about with basketball players and other sports players, do you think the number of cases or just the general problem with mental health has increased due to the social media and increased stress?
Yeah, regarding like social media and the increased number of mental health cases, it's kind of a tricky issue. I think I don't know if you can fully say that. I think there is a contributing factor that there is an increased awareness. With social media, we're now getting increased access to everyone in the world. Everyone can see everybody's thoughts on certain topics and such. But with social media, at the same time, I was kind of reading about this. There's now kind of a link that's been established between increased social media use and the increasing number of cases of mental health. So, just in regards to the increasing rates of mental health and whether or not, it's probably due to increased awareness, diagnosis, I can't say for sure. I think that there's like a multifactorial issue. I think that social media provides an opportunity for individuals to see how everyone else is dealing with it, kind of being able to recognize themselves whether or not they themselves might be going through a mental health issue. At the same time, though, whether or not I can say the increased number of cases is either due to increased awareness or that individuals themselves are now experiencing higher rates of mental health issues, that for certain I cannot say. But there has been studies kind of linking those social media to increased rates of, I guess, depression, just because, just because research has shown that certain social media sources, such as Facebook, it kind of like presents the situation where everyone's kind of looking at their peers. You go on your peers' profile, and you see kind of how they're living, and it kind of alters someone's perception of, the lives of their friends, family, and it leads to that kind of somewhat gap between reality versus what is true. And I think that, what is true not necessarily be all that's, the truth.
Right. So, kind of, we talked about, mental health and its problems, but kind of flipping more to the advocacy side, what does it mean to be a mental health advocate?
I think mental health advocacy is essentially, what you and your podcast are doing right now. I think just spreading general awareness of mental health and acknowledging its existence and the seriousness of these issues right now. Specifically, mental health advocates can be anyone, obviously, who's promoting awareness for it. There are also individuals who, choose to actually reveal their own personal struggles with mental health issues, kind of, providing a voice for those who don't feel they have one, but may be struggling from the same issues. So I think overall, just, providing a better awareness of what's going on, talking about it, things like that.
So aside from podcasting, what are some other ways that people can get involved and advocate for mental health?
I guess on an individual level, friends, family can support those who they think may be struggling through mental health issues through talking, listening, providing that support for them. Besides that, you can volunteer for certain local mental health organizations. I know there's some that allow you to kind of reach out to individuals. I know there's crisis helplines as well that exist. So if you're ever interested in getting involved in, crisis prevention helplines, certain local districts, around the state of New Jersey, I know specifically, provide some training so that you may be able to volunteer as one. Just in general, increasing the awareness talk, promoting and kind of normalizing it. Right now, I think we had mentioned before that mental health is still stigmatized in America. So just kind of normalizing and promoting that, mental health struggles is very common in America.
So, for the last question, how do you think COVID has impacted our management for mental health, or even how mental health is perceived or present in the United States?
So COVID's impact on mental health, it's going to be very interesting. I think the effects of COVID-19 and the impact it's had psychologically on individuals hasn't been fully realized yet. In adolescence, children, talking from that avenue, their daily routines were essentially disrupted. And when there's rapid and dramatic change, such as that, it introduces additional anxiety, additional stress factors that can contribute to the development of mental health issues. I think one of the most important, or one of the most significant ones now, is just the general awareness of how seeing on TV, seeing in the news constantly, the rising infection rate, the rising death count. So you're kind of, as an individual, probably worrying constantly about that. You kind of worry, is that going to happen to my friends? Or is that going to happen to my family, people you personally know? And, for many in America, this has actually become a reality, even around the world. Loved ones have passed away from COVID. At the same time, I imagine some people are very worried about it. Some people are worried about getting it themselves, and kind of just the general, at one point in time, I think there was just kind of a general question mark about how exactly is this going to affect us. And, we're about several months out from, when America first got introduced to COVID.
So as mentioned by Mr. Yamada, mental health is a very important topic and is a growing part of the healthcare field. I would like to thank Mr. Yamada for sharing his valuable knowledge and experience. And I would also like to thank Raiyaan Shaik for recording this podcast, Eli Engler for editing the podcast, and both for creating the questions.